We started, right, in 2015, we started the organization to really promote the use of equitable anti-racist evaluation methods and tools in order to tell real life stories behind the numbers, to really think deeply about what it looks like to truly elevate lived experience data. We can go to the next slide. Awesome. And so as a catalyst for systems change, and especially here in Austin, Measure has grown over the years to a fully operational 501c3 nonprofit that does the work of mobilizing communities that are closely impacted to disparities to be truly stakeholders within the system of evaluation. And so we have two solutions that I just want to kind of highlight. Before we go to the next slide, I just want to highlight the two solutions that Measure brings to the table every single day. Is number one, we provide free data support to powerful Black, Brown, multiracial, multi-ethnic led organizations. We also cultivate community power building to fight structural racism. The problem that we're solving is a major problem, of course, lived experience and quantitative data about complex social problems impacting, again, powerful Black, Brown, and multiracial and multi-ethnic communities are not used effectively for justice due to racism, a lack of equitable data tools, and village support. And we'll talk about how we're changing that narrative. Next slide, please. So at Measure, we start with our problem, right? But then we immediately provide that theory of change, and in my mind, our theory of action. And so we believe that if we support powerful Black, Brown, multiracial, and ethnic communities by providing free data support, training, and work to cultivate this idea of community power building, then powerful Black, Brown, and multiracial and ethnic people and organizations and communities subsequently will be equipped to use data to mobilize and to eliminate social disparities. Our vision really is to have a world free of health, education, justice, and economic inequities. Next slide, please. And so in front of you are the 4 tools that Measure is working to advance in this space. And we actually have a 5th tool. It's a digital techno solution that we are soon to be sharing about. But these are the tools that we share: the Measure Care Model, the Equity Focus Group tool, the Community Survey Design tool, and the Community Impact Metrics tool. What's really the one that I just kind of want to highlight here, even though the Equity Focus Group tool is yellow, really want to kind of talk about the Measure Care Model, because the Measure Care Model really came out of birth through our community. Over 400 community members came to several community meetings so that we can kind of dig deep and figure out what would a good framework look like of evaluation that could truly support especially Black, Brown, and Indigenous-led organizations and mobilization. And that's really what the care model is. So essentially, we connect our certified Measure educators, which you'll learn a little bit more here, with organizations in order to provide them a 12-week service through the care model. And we can go to the next slide. These are some of the organizations that we've worked with so far in Austin, building equity in the Austin Civilian Conservation Corps. We just did that work with the City of Austin, Children's Optimal Health, who is also here as a partner. It's Time Texas, Black Maternal Health Collaborative, Austin Community Foundation. And so you'll see also, which I think is really amazing, is that the Measure Care Model, the Equity Focus Group tool, the survey tool, it can be used in almost every sector of social justice. And it was definitely used in a powerful way to address the issues of digital equity. And so at this point, I am going to pass it on over to my incredible sister in justice and in data activism, the Chief of Research for Measure, Paulette Blanc.
Thank you, Mamie, for that awesome introduction. Good afternoon, everyone. As you mentioned, my name is Paulette Blanc. I am one of the co-founders for Measure, and I also serve as Chief of Research. I was one of the researchers alongside Dr. Urena Onyewuchi and Dr. Rita Taylor, who's here with us today, on the qualitative study that was part of the residential technology study. And so we'll be sharing out those results over the next few slides. Next slide, please. So we summarized our work of the qualitative analysis in a historical timeline and a Black paper, which will be available for review. We'll start off here with the historical timeline. So for us, history is data. And so we built out a historical timeline based off of just independent research and the lived experiences and things that participants shared within those focus groups, and listed it on here. The final documents do have more updates on here, so just wanted to preface that if you see a different version. So for the sake of time, I will just briefly go over each of the items. All of them are definitely worth digging into, and this is not like a full comprehensive list. There's so many things that have happened over time that have contributed to the issue of digital inequity all over the world, and particularly here, we're focusing on Austin. So the first one we start off here is in 1865, looking at the freedmen community. So right after Juneteenth happened, powerful Black people began to settle in the Austin area and develop freedmen communities, which received a lot of persecution over time and had been exiled with the 1928 master plan that is part of the next timeline here, timeline event, where this 1928 master plan was created, and it essentially forced those communities into areas that were designated in that master plan. And particularly, we see that East Side is where the Black community and the Hispanic community were delegated to. We also highlighted just some national and federal policies that contributed to what we see in the landscape of our cities. And one event is redlining. And so this is the Housing Act that really segregated neighborhoods and inequitably distributed resources for the development of those neighborhoods, which ties into a lot of the infrastructural issues that we see. We have here in Austin, 1953, the city adopted an at-large model, and this was really in reaction to the 1951 elections, where an African-American ran for city council, almost won. And so in response to that, this system was put in place, and it really removed the representation on city council and prevented various ethnic groups to concentrate their voting power in a single candidate. We go into 1954 to 57. Here's where we see the desegregation of schools. We also see here this ideation of Austin becoming a tech hub. And so we highlight that there. 1964, we have civil rights movement, which helps to remove a lot of the Jim Crow laws that were still in place, particularly around hiring practices. Here we also have in 1980, Silicon Hills. This is where we start to see Austin flourishing or becoming known and dubbed as Silicon Hills, where a lot of the tech companies are coming into the Austin area. In 1990s, we see this, the first terminology or labeling of this digital inclusion gap. And there are several different programs and initiatives to try to address that. In the 1990s with the Clinton administration, and we do see that with the administration changing to the Bush administration, most of those solutions were left to free market to solve or address any of those issues. In 1995, we have legendary community leaders, Sue Beckwith and Anna Sisnet, started an organization called Austin Freenet, which was one of the first organizations to wire the city libraries with public computers, and so that people could have those in a public space to be able to use. They also still provide services today. We also highlighted the use of social media. We saw that this was really important when participants shared their experiences around accessing resources during the winter storm. Folks who had access to the internet had more of an advantage to finding out what resources were during that time. So this could really be life or death, not having access to the internet in this day and age, particularly too. Lastly, we highlighted the pandemic, which really just highlighted a lot of the disparities that have been happening, and really just brought that to light even more. So overall, this timeline is really intended for us to help see digital inclusion or digital equity as not just a silent issue, but more of a symptom of a lot of the systemic issues that are in place. Next slide, please. All right, so for the other piece of the document, which is our Black paper, summarizes the thematic analysis from the focus groups that were facilitated. This is a community-facing document. As for measure, everything that we do is in service to the community. We want all of the data that we gather and collect to be provided right back to community as a tool for change. So the focus groups are essentially building off of a lot of the previous work that was done. The city of Austin had done surveys. I think the last one was in 2018. UT had done a 10-year study. There's quite a bit of data that's been collected. So these focus groups were used to gather lived experiences of Austin residents, understanding what it's like for them to access the internet and technology, find out what programs or services are helping, and then what community members wanted in order to improve their digital access and literacy skills. So we use our equity focus group tool, which Mimi talked about as being one of our ways or methods for evaluation. For our recruitment, we did recruitment from September 2021 all the way through January, which is when January 2022, when we had our last focus groups. We thought it was very important to make sure that particularly when reaching folks who didn't have access to internet, to keep the recruitment open as long as possible so that they could have a better opportunity to hear about it, since folks who may have internet may have easier means to be able to find out about the focus groups. And so we did that for that reason. We use local community partners for and individuals for outreach efforts. We use social media, public radio service announcements, and distribution of flyers in order to get folks to participate. Overall, we had 54 participants. Most of our sessions were in English. We did have 2 in Spanish, and we had 1 in Dari. I think that's about it. Most of a deeper analysis of the demographic data will be available in that Black paper. And I will pass it to Rita to talk a little bit more about our methodology and go over some of that thematic analysis.
Yeah, thanks, Paulette. So I had the opportunity to support the project specifically on analyzing some of the qualitative data. And when it comes to this kind of data and being very adaptive in our approach, it means we collected a lot of information, got to talk to lots of folks, but we're also adaptive and responsive to the people in the sessions themselves and what they were saying was important. So that sometimes that meant we changed our protocol, which meant we had that influences how we analyze the data. There's so many ways to analyze qualitative data, and that's one important thing we have to keep in mind in analyzing that data. So what we did is we identified key themes in the data across all of the sessions, regardless of the protocol and what questions were being asked. There were still lots of themes that emerged, but really important to highlight. And so that's what we're going to talk about a bit right now. First, we saw a theme around infrastructure and service inequities. So there was definitely a lot of conversation around a lack of internet options, both how to pay or what services to actually have access to, but also how to access services in public spaces through Wi-Fi or through even cell coverage. So a lot of that tied into gentrification and rising costs and how that affected participants' options and choices. As folks were being pushed further and further out, it also affected their transportation costs and being able to access publicly available Wi-Fi or internet sources. And that also affected how they had to make decisions about budgeting for internet access. And it's very unclear how much these things cost and the quality. That also makes it really hard to make decisions too. Lots of folks got access to internet through public spaces like coffee shops, libraries, grocery stores. And as Paul had already mentioned, that historical timeline is really key and valuable in helping to illustrate compounding inequities in our community and how internet access and inequities there show up in that history. And one of the examples we heard over and over in the infrastructure and service kind of theme was around Winter Storm Uri. So folks did not have access to Facebook or other social media tools that they used to communicate with each other, to know what was going on, and to understand be able to prepare for inclement weather or other kinds of emergencies. So that was a really important thing that showed up in the conversations we had. Another key theme was about the, yes, I see a question. This is the study that Measure did that we're talking about. I supported the work as part of the team. So the theme that, another thing that came up that was really important was privilege and existing access. So even in the focus groups, we saw folks who were, had challenges even participating fully in the conversations because of being dropped off or not being able to access through a smartphone or device and calling in. And there was lots of a range of privilege in accessing the focus group conversations themselves. Some people did have privilege and acknowledged that and discussed that, and lots of folks didn't. And so that was really important, us being able to understand their experience as well. One irony in all this conversation around privilege that showed up and surfaced multiple times during the conversations was that without internet access, those who already are experiencing digital inequity, the irony is that so many resources that are out there to improve digital literacy, to improve access and find resources are online. So they're on a space that they already lack access to or equitable access to. And so that showed up often the irony how that compounds inequities, not just in the digital space, but beyond. So part of that was that when the pandemic hit, a lot of folks lost their in-person access to resources, whether it was libraries to access computers and internet, and also to learn, to improve their skills around digital tools, those were lost. So we had a lot of examples that were shared about that experience, whether it was from taking ESL courses that they suddenly lost access to and then weren't able to do online because they didn't have access, or one participant described having to go to a private company to have his emails printed, and that costs money as well. So lots of examples of how lack of access to digital tools and internet is really key in compounding the inequities. And then another key theme was around skills, learning, and then digital literacy. So continuing on that existing privilege aspect, the building digital literacy skills was heavily limited, especially as technology develops and accelerated during the pandemic. There's lots of change in technology, and it's hard to keep up with and then hard to access to and learn about that. So as one person described, they have to read a dissertation in order to be able to learn digital equity tools digital tools they need to access things. And that is very challenging and inequitable in its own right. And then of course, as we already mentioned, a lot of the learning tools are actually online. So you have to be able to access the internet to be able to access those tools and to learn. Participants had a wide variety of resources they used to learn. Often we saw this interesting community-wide and multi-generational relationship between folks and how they learned. And so they learned from each other, from different generations and different experiences and comfort around technology. And then when the pandemic hit, there's a lot of loss there because those social relationships that were in person where there's so much trust built was lost and had to go online in order to access those social networks again. So we saw a lot of, again, compounding inequities there when the pandemic hit. Folks even described going to places like Best Buy or the Apple Store prior to the pandemic to learn how to use different tools or to access the internet, and lost those access points, including the library, when the pandemic hit. So part of that ties to another theme that emerged across the groups, which was navigation, trust, and adoption. There were a number of people who expressed fear or mistrust of technology and the internet, both for themselves or for other folks that they were connected to or supporting. So this was all for individuals and for organizations who were supporting individuals who didn't feel like they could trust the internet or the sources of knowledge they had around the internet. There were lots of things that influenced this. One, a fear around like, how are these organizations and systems being held accountable for things like data breaches or cyber attacks? And then other cases were going to a website, but the language not being in something that someone spoke or read, or the language being so technical that it's hard to access and understand all of the key pieces. Folks who described their learning experience described having to have so many resources in order to kind of self-teach a lot of the topics and issues when they were trying to learn about digital access and technology. So a loss of that in-person aspect, and trust was so vital as well there. And then I'm going to turn it over to Paulette actually to talk about the Spanish and Dari groups.
Yeah, so in addition to those themes that Rita highlighted, those were also prevalent in the Spanish and Dari focus groups. There were just additional themes that we saw to highlight in the Dari focus groups. Particularly, there were two themes: the finding balance and addressing gender gaps that were pretty notable. Participants discussed the desire for finding balance in using the internet, where they wanted to protect their children from overexposure to various contents on the internet, but also making sure that they can build great digital literacy skills to be able to thrive in today's world. They also talked about having better opportunities being here in America to address gender gaps that were caused by societal structures in their homelands, like in Afghanistan, where women weren't allowed to have education and have access to learning in that way. They did note that the pandemic may have hindered a lot of the progress in that way because access was cut off. And lastly, amongst both the Dari and Spanish focus groups, language barriers around accessing educational materials for people who are still trying to learn English was a barrier. So not having materials where you can learn in their own languages in order to be able to grasp the skills needed. So that what we thought were very noteworthy from those specific focus groups. I'll pass it back over to you, Rita.
Thanks. And so all of these themes led us to a number of opportunities that we felt we saw for our community in being able to address digital inequities. And just as quick highlights of those things, we felt like, especially thinking about trust and relationship building, what are opportunities for our community, for our government institutions to partner with folks that already have trusted relationships, to partner with groups where relationships are pre-existing, and what groups are doing that kind of work that may not even be known right now to government agencies or to other institutions about how to navigate things. And there are so many organizations who are navigating digital access for their customers. So banks and medical companies, there are lots of groups trying to do that. How are our local governments supporting that relationship? How are they holding those groups accountable and encouraging greater user experience for our community members in using those tools? Also, there are a number of systems or initiatives or coalitions out there that are doing work that could have models that could be leveraged to understand how to support adoption of tools and addressing digital inequities. Because as we've shown through these themes, digital inequities are not just technology. It's tied to compounding historical inequities across infrastructure, transportation, health, jobs, so many things. How can we partner in a larger system and understand other initiatives that have been successful in addressing inequities in their spaces? Then we also, we're thinking a lot about non-digital approaches to helping to get folks access for digital literacy and digital tools, radio, paper pamphlets. We had direct folks from the sessions recommend other non-digital access points or channels in order to get folks access and knowledge about what their resources may be. And then we really wanted to highlight the Winter Storm Uri as a collective experience, as a way to something we can use as a story and an experience to leverage to help highlight the inequities around digital access in our communities and help others see how important this is, and that it is not just about one tool, having a computer, or just knowing how to use it, or just having the internet. It is about so much more in our lives. And the storm itself really highlights that, and participants in the session really shared that as well. And then finally, of course, accessing the internet is not just about broadband to your house. There's Wi-Fi and cellular. Both of those seem to be really important to participants. They may have had access from their home, but once they left on their phones, they couldn't access because they didn't have cellular coverage in the area. And both of these access points cost money as well. So how can we strategically think about both of those in being able to improve access in our communities? And I'll pass it back to Paulette.
So in conclusion, the insights and lived experiences from community members, in addition to previous studies, provide a solid foundation for generating solutions to address systemic issues. And we believe a lot of these solutions that would come up should be asking, how are we addressing a lot of the systemic and racial inequities that are embedded within the systems that are creating these outcomes. We also did note in the updated version that there are other factors that like regulatory requirements and public policy that shape and are factored into a city's ability to be able to make changes. For example, we saw that in 2005, the Texas legislature assigned municipal franchising to the State Public Utility Commission, and it doesn't allow for input in from the local governments. And so that contributes to the ability to negotiate with the companies coming into and building the infrastructure. Back in the early 2000s, Austin was able to negotiate some of this with cable franchise agreement with, which is I think Grande Communications, that was be able to help mitigate those types of things and even have funding that could bring in funding sources to create digital equity programs. And so with that legislature being in place, it really hindered the city's ability to be able to do that. So those things are also worth noting that they contribute to the problem that we're trying to solve. We also mentioned that digital literacy programs should be designed to support various demographic needs. We saw that there were age-specific needs that also came up in terms of technology being very cold and not having this human interaction as much in there, and the reliance on the younger generation to help older folks with learning new technology skills as they quickly change. There's also cultural differences in languages that also need to be accounted for when developing literacy programs. We also talked about using existing platforms that services in place, like YouTube channels that already exist to provide services in multiple languages. We also talked about the need for having a human-centered design. One particular example that came up in focus group was when during the pandemic, when the school system in Austin, or I think it was in Central Texas, provided Wi-Fi hotspots to school buses. That meant that a lot of the students were actually sitting outside in order to be close enough to be able to access and online learning and being able to complete their work. And so they were outside in various weather conditions to be able to get that done. With employing a human-centered design approach, all of that could be taken into consideration so that people can have a better experience when we develop solutions. There was also outreach and awareness that we took note of, particularly word of mouth being the best ways to reach people who didn't have access to the internet. And one thing that we did note at the time, there wasn't a one-stop shop to be able to find some credible resources to go to. As Rita mentioned, trust was a big factor. And so we developed a Tech Connect resource guide, which was a really quick, not super comprehensive, but provided some good resources for folks to be able to go to. And this kind of just gave them a list of places where they can get tech skills and find about tech jobs to get involved in, and other resources where they could be able to learn. And so folks definitely mentioned their appreciation for having something like that, where there may have been resources online and on various organizations' websites, but if you didn't know that those organizations existed, you would not know to go on their website. So we did provide that as a mean. And so we'll go ahead and conclude here and end our presentation. Thank you.
Thanks so much. So we're just going to roll straight into Susan Malay and Dan being able to share about their work, and we will hold questions. Please feel free to send them in the chat. We'll be following up with comms to registrants at the end of this, so please feel free to share questions. Thank you, Mimi and Paulette, so much. All right, Susan, and I'm going to stop screen sharing.
Thank you. Oops. So hi, I'm Susan Malay with Children's Optimal Health, and Dan Brown is my partner. In the interest of time, I'm going to try to move through this as quickly as possible. We're hoping that Dan can do a demo of how you can publicly access the mapping work that we've done around this theme. But before I go into this, I just want to acknowledge the depth of thought and research that Measure has done here. I am so deeply impressed with what you've done, and I see so many points of alignment here. So thank you for your work. And I look forward to the action call later. So I'll try to describe our project, let you know how you can access the information, share about what we've learned, and then hopefully we'll have a few minutes to do a quick demo on the mapping. Let me move forward. I want to start with thank yous. There were many, many people that helped us with our project. I want to particularly call out Communities in Schools and Austin Voices for Education and Youth, especially their block leaders who went out in the community and helped us with our survey research. As well as the ACC Community Ed Group. They ran our Spanish language focus groups. A call out to community health workers. They weren't a direct target for us, but I learned so much about what was coming back into the organizations that were using them, about what was going on. I also want to call out a thank you to our funders for our project. That was Good Measure, as well as some additional support for GTOPS from the city. And our COH board, who knew that the funding wasn't enough to cover all the work that we did, and they were tolerant of that. Finally, I want to call out Carissa Urrea, who was my research assistant, and I want to congratulate her because she should be completing her master's in public health this spring. Okay, moving on. Digital inclusion includes affordable, robust internet services, digital literacy skills, quality tech support, access to hardware and software, and the opportunities and resources for augmenting inclusion efforts. I think that that is a useful definition from the Texas State Libraries. I want to cover who our priority populations were for our work. They were people that are most likely to be adversely affected by key social influencers of health, such as having adequate income, stable housing and food security, good education, well-paid jobs, healthcare access, and strong community support. These are folks and families who are more challenged in those areas. Specifically, our priority populations included students and their families, especially those that are economically disadvantaged, people of color and non-English speakers, those living in the more rural areas, older folks, and those needing telehealth access. And actually, geographically, our territory was expanded beyond just Austin and Travis County to include the 5-county metro area. So we do have some inclusion in the rural areas as well. We conducted about 20 key informant interviews. We had 10 different focus groups, 4 of which were conducted in Spanish, and collected over 400 surveys from our priority population members. So I want to show you how to access the work that we've done online. I will ask Rita if you can pop the URL for our website into chat. People can access it there. This is the landing page. And if you just scroll down from that landing page and click on the tower photo there, you will be brought into our project. And then if you look across the top of the project here, each of these areas is like a chapter. And if you click on the downward arrows there, then we have separate areas within those. So our methodology and user guide are there on the overview tab. If you go to the Digital Equity and Social Determinants of Health tab, this is really where most of the content is held. And again, if you click on that downward arrow, you can see that we've got separate data stories for education and workforce, for healthcare, for rural communities, et cetera. And within each of these, we have extensive research, our own findings from our focus groups and interviews. We've integrated the analysis of our surveys. And we do call out, so as highlighted here in the blue box, we call out specific quotes that came out of our focus groups. We also were able to work with Measure, and that's another reason why it's just so exciting to co-present today with them. We were able to contract with them to do a special focus group since our direct work was really trying to target our priority populations more directly. What we asked them to do was to conduct a focus group with people of color who are leaders within their own institutions, particularly healthcare and education, who are working within those institutions to improve equity. And so in our build here, under the Neighborhood Story tab, we have their report that they've produced for us in addition to their historical timeline around disparities in healthcare access in the Austin area. And then we pull our different themes together to try to tell the story of Colony Park as an area in the Austin community that had been neglected for decades, and where there is positive action now to address those historic disparities there and improve the quality of life there. And it's being driven in concert with the members of that community. I will move on with more of our findings, and then if we've got time, Dan will do a very brief mapping demo. I do want to point out that we have a theoretical framework that we're using. It is essentially a social determinants of health framework, and that has really grounded our work. And I would say that what we're learning with regard to digital access and digital inclusion is that a lack of digital technology, affordable access, et cetera, has further disadvantaged people from the services and care that they need. Digital access is now starting to be called a super determinant of health, and I believe that's because of findings like ours that are beginning to recognize that, particularly during the pandemic, but moving on, all of these efforts to respond to the pandemic were largely driven by digital access. And so those people who lack digital access, who were likely the same folks who were already challenged related to social determinants of health, were even further disadvantaged. I'll take a brief look at some of the findings from our survey. In terms of diversity, we looked at geography, ethnicity, and economy. In our surveys, we got over, I believe we had responses from more than 20 different zip codes. We did suppress where we had low counts from different zip codes, although all the data was included in analysis. Roughly 2/3 of our population identified as Hispanic or Latinx. We also had people who identified as 2 or more races or other. And then we did include, we had an Asian or AAPI population as well as African American. We were underrepresented of the white population, but I would say that's probably pretty intentional. With regard to economy, we didn't want to ask an income question. So instead we asked, have you basically struggled to meet basic needs during this time period? And I believe it was that about 80% of our responders, 75–80%, struggled to meet needs. So that was our economic indicator. With regard to access, our question was, has a lack of good internet access or devices caused you difficulty in obtaining any of the following? And again, we found that roughly 75% of folks identified that a lack of good internet access impacted education, their ability to work, or healthcare access. We also drilled down into that, and when we looked at that same data and broke it out by race or ethnicity, we saw some differences by those groups. And particularly, I'm looking at the Hispanic or Latinx population and the disproportionate response there that are identifying that they had difficulty with access to education for children and adults. We also wanted to ask about the devices used by households, and we analyzed the question a couple of different ways. In this way, we noted that counting all respondents, so people who responded, we had 434 responses there, but we had a significant portion here who said they have no computer devices. And then we asked, we looked at this in terms of the total number of devices that were identified. And when we looked at the data that way, roughly a third of respondents identified that they do have smartphones. Then we looked at other devices as well. We did have the darker green there. It also still indicates no computer device. And so when we then did the drill down by language of the survey, what we noticed was that for those who said that they had no computer or device, there was a clear disproportionate share of those people who were Spanish speakers that were responding to that. We did ask about how important high-speed internet connectivity was at home. And as you can see in this chart, nearly 100% identified it as either essential or important, with over 3/4 identifying it as essential. So our priority populations clearly recognize the importance. They lack access. We also asked about how they do have access. And again, cell phone or smartphone data plans were frequently identified. But again, we have people who identified no internet access. We also asked about if low-cost, high-speed internet were available, what could you afford to pay on a monthly basis? And I was really intrigued with this response. You can see here that if the monthly cost was between $11 and $30, over half of our priority population indicates that they could probably afford to pay that. And nearly 3/4 of the population, if we could keep that price point below $30, could participate. So I think that that can be informative. So what have we learned? First of all, digital equity is emerging as a super determinant of health. It is essential for education. Failure to address this will ensure impacting the failure to address this will ensure digital inclusion is multi-generational. So investing in that one area will have multi-generational impacts with associated economic and health effects. Digital access is essential for healthcare and our providers, I believe, need to screen for devices, internet access, and affordability. We need to continue that. Smartphones are ubiquitous, but they're really not functional for student work. And that's something that came out time and again, that students were trying to complete written assignments or analysis on a cell phone. That doesn't work. One of my biggest concerns is that we don't have anybody who really owns responsibility for digital inclusion. And as a result of that, what we really need to do is recognize this as a cross-sector issue and respond across sectors to address this. I do have a concern that if we see the pandemic wane, that focus on this area could return to a siloing post the pandemic. So we need to drive policies, we need to drive funding. What I think we can do here locally, first of all, Austin with its resources should actually be a national leader. Those entities that are already working in areas of diversity, equity, and inclusion should incorporate digital equity within that scope of work. Those being most affected by limited access to social determinants and quality of life that result from them should screen and monitor clients for digital access. I'm sorry, I'm trying to go fast and not stating that clearly. We need to be competitive around grants and fund seeking for digital inclusion initiatives, but in order to do that, we need local data. And we can develop capacity within our community by engaging those members of these priority populations and having them help in the solution finding for it. Looking at local anchor institutions, so our school districts, health and social service systems, and libraries are really the core for, I think, working across sector here. We also need to invest in trusted digital navigators who have the cultural and language competence to really help people with where they are. We know that technology will evolve, so this will continue on. And then we need to continue to develop metrics, track, and report progress. And at that point, I'll turn it over to Dan.
Okay, great. Thank you, Susan. I'm going to share my screen. Okay, so I hope you all are seeing this. I'm live in our website right now,
Yes.
And I wanted to show you all essentially the maps and give you a quick demonstration of how to use them. We have several maps that are located throughout this website, and but we also on the far right tab here have them all compiled in one place for your convenience. We have maps derived from the American Community Survey, ACS, showing both demographics, digital inclusion. We also have maps produced by Diversity Data Kids, showing a child opportunity index related to education, health, environment, social economic factors. And then also tracking 211 calls and what needs were expressed in those calls. So these are all interactive maps, and I am going to quickly here. Oh, and I should mention that there is a guide right here that shows you how to use these maps. And I'm going to give you a quick demonstration of that and go to our digital inclusion map. And as you see right now, there's nothing showing. So essentially, in order to show the different layers of the map, you can click on these down arrows and it shows you each of the groupings of the layers. And then if I can turn one on, we're looking at right now households that don't have an internet subscription. And each of these layers sits on top of each other. And we've also, for reference, provided some, some people instead, these maps are done by census tract, but some people prefer to look at zip codes. So we have a zip code layer that you can turn on that sits on top of the map. You can use these buttons here to zoom in and zoom out. If I left click on my mouse, I can sort of pan around to areas I want to see. And I would turn off the zip code layer, but essentially you can see within this one zip code, for instance, 78758, there are several census tracts. The data is by census tract, but at least you can geographically see which zip code those tracts fall within. So I'm going to turn this off for the moment. These layers do sit on top of each other. So right now we're looking at households that have no internet subscription. If I want to see the next layer that sits under it, households with no computing device, I would need to turn this one off. Now we're looking at households with no computing device. Okay, and then if you click on each of these census tracts, if I left click, it will show me, well, there we go. Excuse me. I'm going to go back to this one. It's showing me essentially the information about that census tract. It's telling me that there's 18.7 7% of households that have no computing device, or about 336 households. Also important to note, it's telling me use this information with caution. So the various census tracts, the data each has a margin of error, and they're either reliable, used with caution, or unreliable. So that's just something to be aware of as you're looking at specific census tracts, that some of them are more, the data may be more or less reliable in each one. I see we're coming up upon the end of our time, so I just wanted to give you a quick sort of navigation lesson there about how to use these maps. So I will turn it back over to Rita.
Thank you so much, Susan and Dan. That was really helpful. We know that we're coming up on noon. We're going to give about 5 minutes real quick for our call to action. And Haltan Harmon from the city will be joining us to do that. So we'll be about 5 more minutes. We dropped some links. We will be following up with everyone that registered with the recording and other access points. Please join us on April 15th. We dropped the Eventbrite link to sign up and get the Zoom information in the chat. And again, if you register for this event, if you're here today and we have your email, you'll be getting the resources. All right, I'm going to screen share so that Haltan can come on and share more with us about what's coming as far as resources and funding are concerned.
Thank you. Thank you so much, Rita. Hey, everyone. It's wonderful to see you all. Thank you for being here and spending the time with us. And what outstanding reporting by Children's Optimal Health and Measure Austin on the excellent data work that they've done for us. Just very, very briefly, a quick overview of the funding, because we want to be able to use the data to drive the funding to our region. We're going to actually get deeper into the discussion on funding on April 15th. I know that's tax day, or it used to be. I don't know if it is anymore. How appropriate that we're going to come together then. But let's just go through these slides really quickly on a couple of things that we may want to just keep in mind. So let's go to the next slide, please, Rita. So as you know, the Infrastructure Investment and Jobs Act, this is once in a generation opportunity that was signed into law in November 2021. There's $65 billion to help close the digital divide. And of that, we'll go to the next slide. We are going to have $42 billion for the states. And of that, we're going to get $100 million in Texas. And of that fund, we're trying to figure out what we can draw down into Central Texas. That's why the data that we just all went through with Children's Optimal Health, Measure, and other sources is so extremely important to be able to craft the narrative and make the point and the case why we would need the funding. And this is really important because of that funding, this is going to help the state broadband office, which we just have one, first time ever in Texas, to put together their plan. It's a 5-year action plan. So this one is going to go help them do that. They're focusing on unserved areas, underserved areas, and community anchor institutions. But the great thing is that it has to be informed by collaboration with local and regional groups. So this is where our coalitions are super important. Let's go to the next one, please. Of the Infrastructure Investment and Jobs Act, there's a Digital Equity Act. There's going to be $2.7576 billion. And this is all about meaningful adoption and use of broadband services. They are focusing on low-income, aging population, incarcerated individuals, veterans, individuals with disabilities, language barriers, racial and ethnic minorities, and rural inhabitants. And there are 3 bullet points here. We're going to get much deeper into this in April, but State Digital Equity Planning Grant Program is $60 million, and it's going to help our state, whatever money they're able to get, to develop the digital equity plan. The second is that there's $1.4 billion, and of that is going to go support the digital equity projects that come out of these plans. And then the third is a discretionary grant of $1.25 billion. And these go to political subdivisions, nonprofit entities, anchor institutions, and others, and workforce development programs. So we want to figure out what exactly is in each one, when the deadlines are, what kind of data do we need, how do we craft it? And if we could go to the next slide. Sorry to be rushing through this. I know you all are very busy today, but there's also a program that we would like to encourage everyone to please consider. to be able to sign all of our clients and everyone that we support in the community who might be qualifying for this. And it is the Affordable Connectivity Program. There's $14.2 billion in that account. And it is to benefit those that want to connect to broadband, have broadband, connect to the internet for work, school, healthcare, and more. And so it's a subsidy program of $30 discount per month towards a subscription, and a one-time up to $100 if they pay more than $10 and less than $50 for the device that they get, because there's such a need for device. And these households at or below 200 of the federal poverty guidelines are those that qualify mostly. Sorry to run through this, but let me do another call to action, and that's for April 15th. So the link is in chat. We're going to also share it with you again, and we will follow up. We hope to see you there. Please send us any questions you have pre-event so we can do a deeper dive for you at that event. And I just want to thank Mission Capital and Rita for this outstanding job today, and Children's Optimal Health and Measure Austin for their amazing work. So thank you so much. We look forward to continuing this discussion.
Thanks everyone for joining us. We'll follow up with all the resources. Have a great day.
Could you send out that April 15th Eventbrite?
Yes, it's in chat. We'll drop it again real quick.
Okay. Thank you. It's great.
No problem.
Really
no
great
problem.
information. Wonderful studies. Thank you.